Everybody, welcome back to Drug Talk. As always, I'm your host, Garrett Campbell. In today's video, we're going to be discussing a medication known as Emtricitabine. Its brand name is Emtriva. And before we talk about the medication itself, just keep in mind that this channel is for information purposes only and not to be used as a source for recommendations for your personal health care. Now, during this presentation, we'll discuss the mechanism of action or how this medication works, indications or reasons we would prescribe this medication to a patient, followed by contraindications or reasons we would not be able to prescribe Emtricitabine. Then discuss some examples of dosing, and then finish it off with side effects with percentages. I've put together some slides to go over this information, so let's jump right into it. So the first thing to discuss here would be the mechanism of action, or how this medication works. So emtricitabine is a synthetic nucleoside analog of cytosine. After forming emtricitabine 5-triphosphate, it inhibits the activity of HIV-1 reverse transcriptase. It partly works by being incorporated into nascent viral DNA, which results in chain termination. In terms of indications or reasons we would prescribe emtricitabine to a patient, well, we would often see this medication prescribed in the treatment of an HIV infection. With respect to contraindications or reasons we would not be able to prescribe this medication, well, we just wouldn't give this medication to a patient who had a hypersensitivity to emtricitabine or to any other component of the formulation. Now for examples of dosing with emtricitabine, so in the treatment of an HIV infection, if a patient was using capsules, they may use 200 milligrams orally once daily. However, if they are using the solution, they may use 240 milligrams, which would be equivalent to 24 milliliters, orally once daily. As with all medications, there are some side effects or adverse reactions that patients may experience while using emtricitabine, so I'll go over some of those here now. First, some common side effects may be hyperpigmentation of the skin. A rash may occur 7 to 30% of the time. 8 to 14% of patients may experience abdominal pain, while 9 to 23% may experience diarrhea. Nausea seems to happen 9 to 18% of the time, and some patients may experience an infectious disease. Asthenia or abnormal weakness may happen 12 to 16% of the time, and dizziness 4 to 25% of the time. 6 to 22% of patients may experience a headache, and 5 to 16% may experience insomnia. Depression seems to happen in 6 to 9% of patients, and some patients may experience a cough, rhinitis, or fatigue. Some serious side effects may be lactic acidosis or a hepatitis B exacerbation. Alright everybody, that's all we're going to talk about today with emtricitabine or Emtriva. As always, I'm very thankful you took the time to come by and watch one of my videos. If you found the information valuable and you'd like to help grow this channel, remember you can like the videos, share the videos, and most importantly, subscribe to the YouTube channel. And there's also some links down in the description you can check out as well. But for today, take care.